As our population ages, the availability of quality healthcare professionals nationwide is a growing concern because patients need continuous access to excellent care and staff shortages are often a major challenge. Healthcare organizations are increasingly tapping into the flexible workforce. Research has shown that supplemental staffing is a sound strategy for facilities when it comes to patient care, patient satisfaction, and cost effectiveness.
There's a nationwide shortage of healthcare workers. Baby boomers are retiring. The demand for healthcare workers in specialty clinics and hospitals, nursing homes is increasing. The number of healthcare workers that we have has not kept up with the demand. There's over 338,000 new healthcare positions that have just come about because of more people seeking healthcare.
So we're finding individuals are working less, we're having more utilization, and therefore there's a gap between the supply and demand. A lot of our temp workers have worked in a variety of situations. They have all the credentials, all the licensing of anyone else, and oftentimes they're fresh. They're not coming off of a double shift, or they're not tired from working overtime, so they're able to fill in and help as needed.
Established in 1999 and headquartered in Milford, Iowa, GrapeTree Medical Staffing provides healthcare professionals primarily to hospitals and nursing homes by coordinating them in a more local fashion to fill last-minute or long-term shifts left by staffing shortages. Rated one of the top 10 most reliable staffing firms in the Midwest and certified by the Joint Commission, GrapeTree has over 2,000 active RNs, LPNs, CMAs, and CNAs in a 6-state area: Iowa, Nebraska, Minnesota, Illinois, Missouri, and South Dakota.
The main focus of GrapeTree is to get the right people to the right place at the right time.
When a facility sees that GrapeTree is Joint Commission certified, they can rest assured that we have gone through the same policies and procedures that their regular staff does on a daily basis. Therefore, our temps can just go in and work very well seamlessly with their current staff and not disrupt patient care.
Using the latest technology to help streamline staffing and scheduling, GrapeTree coordinates healthcare professionals to fill last-minute shifts or long-term contracts due to staffing shortages. These stat responders are willing to pick up those last-minute shifts and fill in either short or long-term when the need arises to facilitate non-disruption of care for the patient.
The advantages of a healthcare facility utilizing GrapeTree medical staffing is the ability to get timely healthcare workers when there is that census increase or when that sick call comes in the middle of the night.
GrapeTree's local travel model really is conducive for many people who want to have different experiences in different facilities but don't want to travel a long distance. Everyone gets to sleep in their own bed at night and they can come back home, and so the majority of our healthcare professionals work within a 50-mile radius and they get to pick what facilities they want to work in.
By providing licensed and credentialed healthcare workers who respond to those last-minute needs, GrapeTree is helping facilities provide access to services and quality care to patients.
The level of care that the GrapeTree nurses provide is top-notch. They only provide us with the best. It gives us a lot of flexibility as an organization because we don't have to rely on our own staff to pick up numerous shifts over and over and over, thereby causing some staff burnout. It gives our staff support and allows great, excellent patient care while we're doing that. The staff we receive from GrapeTree are equal to the staff that we currently employ. Vera works very hard to only hire the best, and we'd like to think that that is the experience we're getting from GrapeTree.
At a time when healthcare workers are in high demand and competition is fierce to hire staff, the option of qualified temporary healthcare workers addresses the needs of an organization and its patients.
We think there's a great advantage to having a local healthcare staffing model like GrapeTree, and we want to take that nationwide.
When we do our annual customer surveys, time and time again, people come back and say that they enjoy working with GrapeTree and they believe that we're here working for them to improve healthcare.
Whether it's a facility scrambling to cover shifts or a healthcare worker interested in extra income, this local approach to supplemental staffing can benefit everyone and greatly impact patient care. Learn more today about GrapeTree Medical Staffing, fresh staffing solutions. For more information, go to grapetree.org or call 866-335-0800.